Smith. How are you?
Just fine.
My name's Elizabeth. I'm here to do your assessment today.
Good.
Before we start, do you have any questions?
No.
All right, well, I see you're already sitting in a nice firm chair. We'll use that chair throughout today's assessment.
Okay.
I'm going to start off by asking your name.
Jennifer Smith,
All right, and what's today's date?
February the 12th, 2019.
Very good. And what city are we in?
Texarkana, Texas.
Okay, now do you have any trouble hearing?
No.
Okay, I'm going to whisper something into each ear, and I just want you to repeat that out loud to me.
Okay. Red brick.
Very good.
Train track.
Perfect. All right. Next, we're going to assess your breathing. I want you to close one nostril at a time and just breathe in and out.
Okay.
Good. Great. Any trouble breathing there?
No.
Okay. And I'm going to feel for your lymph nodes next. We're going to do post-auricular, submandibular, and supraclavicular. All right. And then we're going to check your eye movements, your extraocular eye movements. I want you to keep your head straight, just following this pin with your eyes, okay? Good. Keep that head straight. Okay. All right. Very good. Any trouble there?
No.
Look like you did well. Okay, I'm going to listen to your heart and lungs next. We'll do your heart first. All right, and like I said, normally we would listen underneath the clothes for today's video and assessment. I'm going to keep doing it over the clothes.
Okay.
This is just for breathing now. Good. Okay, I'm just going to listen on the sides here. Okay. Listen on the back. Move forward a little bit for me. All right. Okay. Last time. Very good. Everything sounds nice and clear. And next we're going to assess your muscular strength. So we're going to start with the head first. I want you just to push against my hand up here. Very good. And now back. Good. All right. To the side here. Either way. Yes, ma'am. And perfect. And you'll just shrug up with your shoulders. Good. Now we're going to test hand strength. Perfect. Push up against my hands. All right. And push down. Good. And then in. Push, push, push. Good. And then out. Very good. I'm going to check for knees next, and you'll just push up together with your knees against my hands. Very good. All right. And then next we're going to check your ankles and feet. You'll push back with your feet together. Good. All right, and lift those toes up for me. Now push down. All right. And then lift those toes up together. Very good. Now I'm going to do the inside. You'll push toward the inner. Very good. And then out against my hands here. Perfect. Well, it looks like you had great muscle strength. Any questions about the assessment so far?
No.
Okay. We're going to move on to the Tenetti part of the assessment next. And that's where we check balance and gait. And the gait's going to be your walk. Normally a Tenetti assessment takes about 10 to 15 minutes, but for the purpose of this video, we're going to shorten that time, okay? All right. So I see you're still in that nice firm chair. I want you to go ahead and stand up for me. Now, Miss Smith, you don't use any walkers or canes, do you?
No.
Okay. If you'll kind of get your feet 4 inches apart for me, All right. Looks like you're nice and steady. You can put your feet back together. And we'll have you kind of rotate back around here. Okay, nope. Just stay right in front of that chair. Perfect, that's okay. We're gonna do a nudge test next. And I'm gonna push against your sternum. I'll have my hand behind you the whole time so you won't fall. I'll catch you.
Okay.
There's just gonna be a little pressure, just checking for balance, okay? 1, we'll do this 3 times, okay? 2, and 3. All right, good. And next I'm gonna have you close your eyes. I'm gonna count to 10 and just keep those eyes closed. I'll have my hands here the whole time. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Very good. You can go ahead and have a seat back in this chair, Ms. Smith. All right. Okay. So next we're going to move on to the gait portion of the assessment. If you'll go ahead and stand back up for me. Oh, you know what? I forgot to have you do one step with the balance. It's okay. Stand up. I'm going to have you turn in a circle for me. Doesn't matter which side.
Okay.
I'm so sorry about that. Very good. Okay, not dizzy. Feel okay? All right, well, we're going to move on to the gait portion then. So what I'm going to have you do next is I want you to take about 10 steps there and 10 steps back to me, just looking at your gait, your walk.
Okay.
Very good. Well, great. Well, I'll let you go ahead and sit back down in the nice firm chair here. Okay. Well, it doesn't look like you had any problems with your gait or your balance. It doesn't seem like you're a fall risk. I've had a chance to kind of look around your house since we were visiting earlier, and I noticed you don't have any rugs or extension cords. That could be a trip or a fall hazard. Do you have any small pets or animals in the house?
No.
Okay. What about grandkids or great-grandkids?
I have grown grandchildren and 2 great-grandchildren.
Okay. Do they come visit you often?
Not real often.
Not real often. Well, when they do come, make sure that they keep, the floor nice and clean, that they're putting their toys up so that we don't trip or fall. And then speaking of those great-grandkids, do you have any, where do you keep your medicines in the home?
In my room.
Okay. You have like a medicine cabinet that you keep them in, or a storage box? Okay. Just make sure that they're outside where they can't get them. And I know you gave me a list of your medicines earlier today. I had a chance to kind of review them. Now you told me that you have Medicare. And do you have a supplemental insurance with that?
Yes,
Okay.
I do.
So you don't have any trouble affording your medications right now?
No.
Okay. If that should ever change, make sure that you talk to your care provider about that, because it's real important that you keep on your medication regimen. And there are sometimes resources that we can help you with. So just be sure to talk with your doctor.
That's good.
Okay. Well, Ms. Smith, thank you so much for allowing me to come in your home today. I really appreciate it.
You're welcome.
All right. Thanks.